Good afternoon, everyone. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Wednesday, March 3rd. Dr. Fitzgerald will now give an update on the latest numbers.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. Since the media advisory yesterday, we have 3 new confirmed cases of COVID-19 in our province. All are contacts of previous cases. 2 between the age of 20 and 39, and 1 between the ages of 50 and 59. The total number of cases in our province is now 997. There have been 57 new recoveries, 56 in Eastern and 1 in Western Health, leaving 149 active cases in the province. 9 people are in hospital due to COVID-19. And in total, we have tested 113,503 people. 113,503 people, sorry. We have had several days in a row with only epidemiologically linked cases, and that means that our new cases are linked to previous cases. This is good news, really, and indicates that we are heading in the right direction. Our testing numbers are down somewhat, which could indicate that there are fewer contacts and fewer people who are symptomatic. It shows that people are staying home and following public health guidance. We still need to find any and all cases of COVID-19, however, so it is critical for us to determine the risk of community spread. So if you develop any symptoms of COVID-19, use our online assessment and referral tool to book a COVID test, or call 811 if you don't have computer access. If your test is negative, stay home until 24 hours after your symptoms have passed. We have a balance to strike in the coming months, preventing COVID outbreaks and community spread while working to get as many people vaccinated as quickly as we can in order to prevent severe illness and death. And while the vaccine clinical trials provide us with the evidence on effectiveness and safety, these are under controlled criteria with short intervals in between doses. Real-world evidence is now emerging and shows that the first dose of COVID-19 vaccine offers protection for a longer duration. Current evidence is suggesting that high vaccine effectiveness against symptomatic disease and hospitalization for several weeks after the first dose of vaccine. This evidence, plus the principles of vaccine science and immunology, and our limited vaccine supply, leads me to recommend today that Newfoundland and Labrador extend the interval between first and second doses of COVID-19 vaccine to 4 months. This will allow us to protect close to 40,000 extra people with 1 dose of a highly effective vaccine by the end of March. It will also help to prevent symptomatic disease, hospitalization, and deaths during this most crucial time of higher disease prevalence and limited vaccine supply. Health Canada's recent approval of the new AstraZeneca vaccine will significantly boost these efforts by providing another safe and effective vaccine. All provinces and territories will receive their first shipments of this vaccine next week. Newfoundland and Labrador will receive about 7,000 doses initially, and we intend to start administering as soon as they arrive. We know that the AstraZeneca vaccine has been proven effective in those under 65 years of age. We continue to prioritize older individuals for the mRNA vaccines, as the evidence to support their use in this group is more abundant. This recommendation could change as well, however, pending new evidence for other vaccines. Adjusting our strategy to account for new vaccines, as well as increased dosing intervals, means we can move through our priority groups faster and provide greater level of community protection sooner. If you are in the over 70 age group and have pre-registered for your vaccine, please note that it may take some time for regional health authorities to contact you. When a vaccine dose is available for you in the week or months ahead, your information is in the system and you will be contacted. I know that it seems that we are back in the same position that we found ourselves in almost a year ago, but please be assured that this is not the case. We are in a far better place than we were last March. We know so much more about the virus and how to protect one another from it. And each day we have more people vaccinated. We know when and how to lift restrictions in a safe manner, and there is absolutely a light at the end of the tunnel. I know that there is still much worry and anxiety right now, and regardless of your age or what you are struggling with, and it could be family circumstances, your job, or social isolation, please know that you don't have to go through it alone. There are so many options available there to support you. BridgeTheGap.ca is an excellent resource to connect you with programs and services that are confidential and free. It has been a long and hard 12 months, and we all need to take care of ourselves and our mental well-being. I encourage everyone to practice mindfulness. This is Mindful March, and our province is launching a 30-day mindfulness challenge on BridgeTheGap.ca. The challenge starts every Tuesday and is available in French and English, and it only takes 5 to 10 minutes a day. Everyone who registers for the challenge can invite a friend to take the training with them. I myself have been practicing mindfulness meditation for quite some time, and I find it quite helpful, especially in times of anxiety and stress. As a recap, for those who may have just joined us, we have 3 new confirmed cases since yesterday's media advisory, and the total number of cases in the province is 997. Please continue to support each other, maintain strong social connections while at a distance with your friends and family. Check on each other regularly with a phone call or a Zoom meet or a window visit. One day soon, we can all be together, hug one another, and have family dinners and parties with friends. We have every reason to be optimistic about the future. COVID-19 is for now, but it will not be forever. So hold fast, Newfoundland and Labrador. Thank you.
Thank you, Dr. Fitzgerald. Some excellent news today for an optimistic future, for sure. Next week marks 1 year since the World Health Organization designated COVID-19 as a global pandemic. And I'm sure we all feel like it's been more than 10 years. But while we deal with the magnitude of this virus and its impacts, we must constantly remind ourselves of the positives. And this week, today, is great news. The light at the end of the tunnel is brightening. It's getting closer. It's a year later than we are heading into the next phase of our vaccine rollout. The national narrative on vaccines has shifted from if to when and how. Shipments are increasing exponentially, and that will in turn accelerate the rest of our rollout plans. Our goal here at home is simple. Get everyone in Newfoundland and Labrador their first vaccination as quickly as possible. And with likely over 80,000 people vaccinated by the end of the month, we are well on track. 80,000 Newfoundlanders and Labradorians, and that's just the start. With the change of the rules today, this means roughly, as Dr. Fitzgerald referenced, an extra 40,000 people vaccinated with 1 dose by the end of the month. By spring, if this goes as planned, that number will be even higher. So for those over the age of 70 who haven't registered yet, please do so as soon as you can. And if there's someone in your life who is over 70 and you could help them register, please do so, like your parents or your grandparents or your neighbor or family friend. Go ahead, reach out and help them. We will keep everyone up to date as more vaccines make their way here to Newfoundland and Labrador. Doctors Fitzgerald, Haggie, and I are in a unique position to be able to approach this all through a medical lens. The measures taken, the travel restrictions that have been put in place over the last year, all have been tough decisions made with the health and safety of our province in mind. We will all continue to do that until the vaccines do what they should do. Our curve flattens out again. We all breathe a little easier for once in a long, long year. Till then, as always, follow the health guidelines and stay safe, Newfoundland and Labrador. I'll now invite Minister Haggie for a few comments.
Thank you very much, Premier. Indeed, day 360, and that since we started these briefings, we all have slightly different clocks. But you're right, it's not far off the year since the declaration of a pandemic. But it is a positive day. We see that our active case counts have fallen now to levels we haven't seen since January, and we see low daily numbers, and these are linked to cases we already know about, all very positive. The news on the vaccine front is again encouraging. Our system capacity through public health to administer this is nowhere near even challenged by the numbers that we anticipate. in deliveries over the course of the next 4 weeks. It's running at less than 50%, and that's without involving our other partners, such as our pharmacists and our family physicians, who stand ready to join in should we find ourselves in the lucky situation of having even more extra vaccine. We have stockpiled and pre-staged syringes and supplies necessary for administering the vaccines through the regional health authorities, and there's no supply limits on PPE for people called upon to administer the vaccine. As of 8 o'clock last night, when the phone lines and the internet site shut down for the night, there were well over 46,000 people pre-registered out of a population eligible of around 76,000. With new vaccines coming and J&J and Merck allying almost in a wartime scenario where they're working together for a common aim to produce one vaccine, it is potentially the case where we can see certainly a new summer this year where a significant proportion, if not all, of those people who need and want access to a vaccine would have been able to have it by the summer of this year instead of the fall, as we had thought. And imagine what that would do to our day-to-day lives as we get that level of protection. Again, it's a stressful period, but there's such optimism here, it really is worth emphasizing that first. Secondly, I too did the Mindfulness Challenge when we introduced it a couple of years ago onto the newer Bridge the Gap, as it then was, and I too have found it helpful over this last year, and I would encourage anyone and their friend to join in, log on. It's free at no cost. So with that, Premier, again, I would echo everyone's comments about it being another positive step, and I'll hand it back to you for the rest of the event. Thank you.
Well, thank you very much, Minister. I'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 5 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
With those 7,000 doses of AstraZeneca expected, and right now with the rollout being primarily aimed at older people, who are going to get those doses when they arrive?
So, Peter, we're still working through that right now, and certainly looking at where they would have the most benefit, and where, who would receive the most benefit from getting them. So as soon as we have that information, we'll certainly be coming out with that. But we're still working through it at the moment.
And with this move to give more people first shots and delay the second shots, what would you say to, for example, people who may have family in long-term care homes who were going to get a second shot, which we know has proven long-term protection, and are now going to have to wait a whole lot longer and maybe worried that their loved ones might not be as protected as they could have been?
So I think what we have to remember when it comes to vaccine protection is that the more people that are protected, the more protected we all are, right? So I think allowing us to get more people protected will actually be of more benefit to their loved ones in congregate living settings, and making sure that our society is protected faster is certainly going to help in the long run.
In addition to the real-world evidence that's coming forward on the second doses and how the efficacy of that, certainly Dr. Fitzgerald has stated that in terms of the efficacy with respect to the new interval, so people won't be unprotected.
Thanks.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you, and I guess this would be a bit further to Peter's question that he just asked. For those that are currently awaiting that second dose, so they've had their first dose and now they're in the queue waiting, are they going to be, are we extending their timelines for when they can get their second dose, or are we still aiming to vaccinate them within the initial guidelines for intervals, and what was announced today more so be for those who are still yet to get
Yeah, so we're going to actually pivot right now, and we're going to move to an extended dose interval of 16 weeks or 4 months for all doses. So that will include, so anyone who is in the queue to get a second dose, we will be extending that interval as well. We want to get as many people protected with that good, effective one dose as we can.
Okay, and my next question would be for Dr. Haggie. Yesterday we heard of the first case of a paramedic in the province contracting COVID. And even before the pandemic, we were hearing of the strain put on the paramedic system. What plans can be put in place now to mitigate further strain on that group, as now they're not only dealing with a positive case, but also other workers having to isolate due to being close contact?
Yes, I mean, it's difficult to go into some detail, but we do know that a modest number of paramedics, particularly those who've worked for regional health authorities, have actually been vaccinated. The first line, the frontline responders, be they police, volunteer firefighters, or paramedics working for private companies as well as regional health authorities, they are at the head of the lineup for vaccination. One of the big discussions around how to deploy vaccines is, this is an age group that are at risk and are otherwise healthy and might fit the criteria for AstraZeneca. So we're looking into, through Dr. Fitzgerald's shop and the ethics consults and the vaccine group, as to how best to deploy that in a justifiable, evidence-based way, and how best to protect particularly people like paramedics.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Minister Haggie or Dr. Fitzgerald, when it comes to the pre-registration for vaccinations, we now know, based on the timelines you've given, that we're going to be going through our phases a lot faster here. So are we looking to open up that pre-registration to phase 2 recipients maybe earlier so that we can get through these doses, or is there a timeline as to when people can really start to look to book for those outside of the age of 70 and above?
Not seeing Janice take. Oh, Dr. Fitzgerald, do you want to take that, or shall I?
Yeah, so we're still looking at exactly how our pre-registration system will be affected by this new information and evidence, and this change in the way that we're going to do things. So again, in the next few days, I think we'll have that information. For right now, we're continuing with the 70 and above. That's who we're focusing on at the moment. So we still got a bit of time to get through that group. So once we have things figured out a bit more, we will certainly advise.
Thank you. And when it comes to the pre-registration, we've heard from a lot of those who have done so online that there's no confirmation that they're registered or for a callback or anything like that. There's a lot of concern being like not knowing if they've for sure been registered or not. Are we looking to alter the system to allow for an email that says confirmation here, or are we looking to change the way that system is currently functioning?
I'll take that one. Again, if Dr. Fitzgerald doesn't mind, there's a bit of a lag here, so I can't see her taking a mask off. From my point of view, I've been made aware of that, and I'm actually having discussions with our staff through them to NLCHI to see what back-end alterations would help in that regard. So we're on it, but we haven't got the solution just yet.
Thank you.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
A question for Premier Furey. The light at the end of the tunnel cliche. The same cliche was used earlier today in the federal government's briefing about the status of COVID-19. My question is, countries with economies not even a tenth of the size of Canada's, like Morocco, they expect to have 80% of their citizens vaccinated by the end of April. The U.S. expects to have every U.S. citizen vaccinated by the end of May. Canada's goal, according to the Prime Minister, reiterated as recently as an hour ago, is to have all Canadians vaccinated by the end of September, like 5 months later. My question is it too early to be talking about lessons learned?
Sorry, what was I heard all the preamble, Roger, but missed the actual question. I apologize.
That's okay. Is it too early to be talking about lessons learned?
I think it's, we're learning lessons as we go, and there'll be plenty of time, as I've said before, to do a kind of post-mortem on the pandemic and what was done right and what was done wrong. And some of those countries, though, that you refer to don't have the vast geography as Canada, and there's geographical challenges and different challenges that are unique to every country. But there are certainly lessons to be learned, and I think, there'll be plenty of time to do that afterwards. But for right now, I think that the change that we're seeing today for our own province allows us to pivot quickly, to to adapt to real world evidence. And as Dr. Fitzgerald has always said, as evidence becomes available, we will change and pivot where necessary. And this allows us to really create a hopeful, hopeful future and a hopeful month, to be able to unlock this vaccine for so many more tens of thousands of people that last week was not necessarily a possibility. So there'll be plenty of time on a national and international stage once this is all said and done to look in the rearview mirror. I think it's premature at this point.
Second question, the 500,000 doses of AstraZeneca that are coming, they aren't coming from the U.S. They're coming from, as I understand, the Serum Institute in India.
They're coming from India, correct, yeah.
Yeah. And according to the current issue of The Economist magazine, the Serum Institute expects it to take 2 years before global supply of COVID-19 vaccines meet demand. So the supply issue for Newfoundland isn't going to go away. And as long as we're totally dependent upon the federal government, whose track record isn't great, what's the evidence that they're going to be any more successful in the future than they've been in the past?
Well, I haven't read the article in The Economist. I do really read The Economist quite frequently, but haven't read that one particular. So I can't comment specifically, but I think you're seeing, the economies of scale starting to happen here as well, including, as Minister Haggie referenced in his opening remarks, Merck and J&J working together in a partnership really not seen since WW2 to scale this vaccine. I think the other thing that we need to be cognizant of and always remind ourselves, as you've heard Dr. Fitzgerald say before and others say before, that there is a possibility, a distinct and real possibility as we see these variants come, that this will be a multivariant disease that will be with us for a long time, and vaccines will be a part of our life as they are for influenza and other diseases as they change and evolve as viruses often do. So I can't comment on the specifics of the Serum Institute in India and whether they think, whether that judgment was done based on them providing on a global stage or to their own population. But I'm quite confident with the amount of, the number of companies now being approved and the scale that's being exercised that we'll be able to achieve our goals.
Our next questions are from Andrew Waterman with The Telegram. Please go ahead.
Yes, good afternoon. I was wondering if you can give an update on vaccine distribution within Indigenous communities.
That's for you, Dr. Fitzgerald, perhaps? What specifically maybe is a...
So certainly within the communities in Labrador, vaccine has been distributed, and I think all communities have received at least one dose. All the communities identified for phase 1 have received one dose, and we certainly have engaged and are going out to other communities as well, and we will certainly be connecting going forward with our Indigenous partners for phase 2.
And I was wondering as well how you prioritize within a given community. Like, is it similar? Is it kind of like a microcosm of the broader trend where you see, like, say, seniors or people with other complications or with some complications? And I'm wondering if whether it's on track as well with the stated plan of distribution.
Are we on track with seniors? Is that what you're asking?
Or was the question about how we distribute within an Indigenous community specifically?
Yes.
think it
and
depends
whether
on
that's
geography
on track.
and other things, yeah.
So, with some Indigenous communities, we've gone in and because of their remote and isolated situation, we've had to go in and we've given it to all adults who wish to receive the vaccine. And then in some communities, where there was less issues with remoteness, and so perhaps easier to get to for a second dose, we've got, or not second dose, but for future groups, we've done people over the age of 70, for example, in some of those communities. So it has varied depending on the community, depending on the situation and the geography of the community.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Question about releasing of information. When you look at outbreaks in schools and child care centers, right now that information isn't published online. It's only been sort of released by request. A lot of other provinces are putting that information for anyone who wants to access it. Is there a plan to more proactively disclose that, and if not, why not?
So I think, we have to consider certain things. I mean, when we feel that there is a need from a public health and safety point of view, we have certainly released information that talked about location. When we talk about situations where, there may be one case or two cases in a school, for example, you could run the risk of someone being able to be identified, especially if that school is still in session and, the children or staff may be out. People may be able to put two and two together, and that causes those people to be able to be recognized or identified, and that can lead to stigmatization and that sort of thing, which we don't want to happen. So I think it's very situational dependent. I mean, certainly in the past when we felt like there was reason to release the information from a public health and safety point of view, we did that, and we will continue to do that.
And a question about the number of people who are going to get vaccinated. If I heard correctly, it's an additional 40,000 plus the 40,000 that were planned. So with 80,000 vaccinations this month, how far do you expect to work your way through the priority groups?
So, the priority groups, there's a lot of people in the priority groups. And certainly we know that we have 70,000 over the age of 70, so or 75,000. So, that's a significant portion there. We certainly hope to be able to make good progress through that group, and then some of our other more vulnerable groups in phase 2.
Thanks.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. I have a question about logistically how the next phase of the vaccine rollout is going to work. I know that vaccines like Pfizer, for example, have to be administered where stored. So does this mean that we'll be setting up vaccination clinics at centralized locations like the Health Sciences Center, or are we planning on doing something different? How will that work?
So the RHAs, are very good at being able to mobilize vaccine. They do it every year for flu. The basic principles are still the same, but we'll have to the storage issue really. Once a vaccine goes into the fridge, then it has to be used, depending on the vaccine, it has to be used a relatively short period of time. For Pfizer, it's about 5 days or so. But what will happen is once they're transported to the site where the vaccine clinic is going to be, they'll be kept in that fridge and they'll be used, and likely they'll be used, they'll all be used because they'll be pulling out enough for that clinic. Logistically that's not going to, it won't be a huge limiting factor. I think, they've certainly figured out how they're going to work through that. And it's similar to how things have been done for other vaccine clinics. So it becomes a little bit more logistically challenging, I think, when we're sending it out to smaller areas. And certainly if maybe we don't have exact numbers, if it's not appointment-based or something like that, it may be a little more difficult. But as we have more vaccines like AstraZeneca, which are stable at 2 to 8 degrees coming online, that's going to make it much easier for shipping to those areas.
Thank you. And Dr. Fitzgerald, at the start of the most recent outbreak, one of the big concerns that public health was bringing forward was that we were seeing large numbers of close personal contact. Now that we're a few weeks removed from that, what are we seeing in terms of close personal contacts? Have those numbers been decreasing, and what are we seeing?
Well, yeah, I mean, with the special measures orders, of course, that certainly limited the amount of contacts that people can have. And so, most of those contacts happened at the very beginning of this, and that's what triggered those special measures orders. So we're certainly not seeing what we would have seen previously, but that's really to be expected given what we've had to do over the past 3 weeks.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Dr. Fitzgerald, on Monday you noted that a lot of the cases from this outbreak, many of them were under the age of 20, they had mild symptoms or were asymptomatic. And noting that testing has decreased in the past few days here, are we looking to begin asymptomatic testing or random testing, spot testing, anything like that to find some of these cases that may be asymptomatic?
So we're certainly looking at a testing strategy going forward for how we're going to approach this in the future. And we've had lots of good examples from across the country. We've had lots of evidence from across the country about what works, what doesn't work so well, what's a good use of resources, what's not such a good use of resources. And so we are looking at all of that now going forward, and we are hoping as we come out of our lockdowns and as we ease up our measures, we're looking at how we can use testing as part of our strategy, I guess, going forward. The development of these variants of concern, seeing these spread throughout different areas of the country, certainly our experience with it here, we can say that it has really changed the way we have to approach this disease now, and it's almost like we're dealing with a new virus in some ways. So we have to be cognizant of that. So it is, as we've said many times before, we have to stay humble in the face of this virus. And as the evidence changes, as the virus changes, so too must we. So, we will be looking at that going forward.
Thank you. And Premier, I understand you and Minister Haggie met with the union that represents respiratory therapists on Monday. Are either of you concerned about the number of workers who can operate a ventilator in the province? And can you give us an indication of what came out of that meeting?
Well, I think it was a good meeting. Of course, I've worked with many respiratory therapists in the past and understand the importance they play in the full medical team, and we listen to their concerns. We listen to their short-term and long-term concerns, and we committed to helping them navigate the short-term situation by discussing with the regional health authorities the protocols in place to ensure that their members are adequately staffed and looked after during the crisis. And then in the long term, of course, there has been the commitment and continued commitment to graduate people. I think it's 2022 is the first is the next class, and look at a recruitment and retention strategy for respiratory therapists as we move forward. I thought it was a good meeting. I thought it was very useful and to hear their concerns and to develop strategies again in the short and long term.
Thank you.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
Canada, it's been asked before, does it cost us anything for the vaccine?
The federal government is providing the vaccine and supplies.
And I don't want to ask you how we get from 40,000 to 80,000 people vaccinated this month. I think it's been well explained. I'm curious how we get to 40,000. Perhaps Dr. Haggie, how many vaccines did we get last week, and how many have we gotten this week, or do we expect this week?
The numbers for Pfizer are fairly consistent, and they do give us about 2 weeks of lead time. Moderna is utterly unpredictable, and AstraZeneca, we know, will arrive in Canada sometime today. Exactly when that's going to be distributed is not immediately clear as yet, so we're not sure when we'll get that. We have been getting 6 trays for the last couple of weeks of Pfizer, and there are now I think 1,050 doses in each individual tray. By the end of March, we will have had over 83,000 doses or thereabouts. I may be off by a couple of thousand. And some of those had been earmarked for second doses. Now those will be freed up for new first doses. And if you add in the AstraZeneca, our share is 7,000, then we'll get about 90,000 doses in all over the course of March. Now, we've administered some of those already, I think about 25,000. But again, I could get you a detailed breakdown of those figures. So it jumps our number of individuals who are eligible for first dose quite significantly. But it doesn't approach the capacity of the public health element of vaccination to actually deliver the numbers. It's probably less than 50% of what could be done based on our flu experience, for example, this last fall.
Okay, so if we get 6 trays...
You've had your 2 questions, actually, Roger. You'll have another opportunity in the next round.
Okay, fine, thanks.
Our next questions are from Andrew Waterman with The Telegram. Please go ahead.
Hello. So I've been hearing from some early childhood educators in the province. They've been contacting us and saying the amount of masks they are being provided, which my understanding is about 50 a month per early childhood educator. They're saying that if they're changing them the recommended amount, even the minimum recommended amount, that equates to about 10 days supply, or 2 weeks, I guess. I'm wondering if the amount of masks being provided to early childhood educators is being reevaluated at all, or if they will be stuck with covering those costs.
So I'm not sure what the recommendations are, but people are allowed to wear the mask all day, and the recommendations are to remove it if it becomes wet or somehow soiled in some way. But generally speaking, you can wear your mask all day. So I'm not sure if there's a different recommendation there that people are going by. And as to the other, I don't have an answer there.
Andrew, if there's people out there with specific questions as to their own daycare and the supply, please reach out to the department and we'll try to sort it as quick and as best we can.
Okay, thank you. And just one clarification point, I guess. They also mentioned that on Monday there was some discussion, Dr. Fitzgerald, with regard to, and you just alluded to it there, with regard to masks getting wet and that sort of thing, and it not being absolutely necessary for people to wear it, from their car to the door of a store, for instance. The early childhood educators I've been speaking with have been asking about that because, of course, they take their kids outside for exercise and for play, so they just wanted some clarification. They're hearing from the Department of Education and Early Childhood Development that they're supposed to wear their masks outside. Can you give some clarification surrounding whether they should be wearing them outside or not?
So I think the recommendation with regard to not wearing them outside is if the weather is poor, and certainly if they get wet, and then if they do, they're not as effective if they get wet, right? So that's why we recommend that you change them. So I think people have to use their judgment in that regard. Certainly our recommendation is for masks to be worn, certainly indoors. But the outdoor question, we can certainly get some clarification on that for operators, if that's a question.
Yeah, that would be greatly appreciated.
Thank you, Andrew.
I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
I do. I just want to follow up on something Dr. Fitzgerald said about treating this essentially like it's a new virus. What's that going to mean as we work our way out of the alert levels? How will the new normal be different than it was before we were dealing with the variant?
So I think, what we found out from this variant is that we certainly see a lot of spread in those social situations where people may let their guard down a little bit more, where they may think that they're protected. We had, and I can't give you the exact number now, but we've certainly had a significant number of households, for example, even when people were isolating away from other members of their family, in a separate bedroom, maybe even using a separate bathroom, we still had a significant number of households where everybody in the household became infected, even being very cautious in that regard. So we do have to be more cautious with regard to how easily this can spread. It is going to change what we have to do with regard to gathering sizes. It's going to change what we have to look at with regard to those situations where people get together in groups, such as sports. So we do need to think about how we're going to deal with that going forward. And we're going to have, given that we have this opportunity now to try to get as many people vaccinated by the end of June or middle of July as possible, I think we really need to double down on our efforts to reduce those contacts as much as possible and to reduce the risks. So it is going to look a little bit different, I think.
Thank you.
Richard Duggan with VOCM, do you have a final question?
I do. We keep talking about how mass immunizations will lead to an eventual herd immunity, but people under 16 can't get vaccinated as of right now. So is herd immunity truly possible if such a significant portion of the population is still unable to receive the vaccine?
Yes.
That's a good question. Herd immunity, it depends on the virus, and some viruses we need to have a lot more of the population vaccinated in order to reduce the spread of it. For example, measles, you really need to have 90% plus of your population vaccinated to make a dent in that spread. But if you're other viruses, not necessarily, or other, not just viruses, bacteria as well. So, with COVID, I think we're still learning about that information at this point. Certainly, we know that, vaccinating children is something that will need to be a part of our vaccine strategy. And we hope to have more information about that from the companies in the near future. But those studies are ongoing. So I anticipate that we will have recommendations for children at some point in the near future. We're just waiting for those now.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Do you have a final question?
Yes, thanks, Leslie. Dr. Fitzgerald, with the new announcement of the time between doses, knowing that more doses are coming to the province, looking to get through more people being vaccinated sooner, understanding that this likely changes the plans currently in place for phase 2 and phase 3, are you looking to add more of those high-risk candidates to early vaccination lists, like those with diabetes, asthma that might not have led them to hospital, things like that, knowing that you already have the clinically extremely vulnerable? These are people that may not have to have been hospitalized in the last year?
Sorry. Our priority groups will stay the same. We've identified these priority groups as people who are at higher risk of severe consequences from the disease, or at a higher risk of exposure, or are necessary for, continued health system infrastructure or other critical infrastructures in the province. And so based on that, I don't know that we'll be changing phase 2 priority groups. We hope that we'll be able to move through them faster, and so we'll be able to get to our phase 3 a little bit faster, and thereby be able to vaccinate everyone faster. But I don't think we'll be changing the priority groups at this point.
Thank you.
Roger Bill with the Shoreline News. Do you have a final question?
Just one for Dr. Fitzgerald. I share your enthusiasm after getting a number of new cases down to 3. If the numbers stay down like this for the next several days, are you open to the idea of, or the option of reviewing, staying in alert level 5 for another week?
So I think at this point, you know, in addition to us having to have low cases, we need to be looking at a few other things, and we're looking at how we're going to approach this from a community point of view, and just seeing if we have more cases in our community that we don't know about. So we're looking at some testing strategies that we'll need to follow through on before we really feel comfortable making that decision, and I anticipate that's going to take more than the next few days. So I think we'll be into next week before we can make a decision on it.
Andrew Waterman with the Telegram. Do you have a final question?
I do, yes. I was wondering, and my apologies if this was asked before, I actually had to switch my phone out because of bad quality, but if there was an update on the recent case that was in the Labrador-Grenville Health region, where a healthcare worker at the hospital in St. Anthony tested positive. Is there any update on that situation?
Minister? So I don't have an update as of just coming into the briefing today, but certainly if you have any questions in particular, you can direct them to us, and I'll try to answer them for you once I get back to the department. Apologies.
Thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Sure. Thank you all for joining us today. This is a game-changer day for the vaccines, and it's good news for our healthcare providers, good news for businesses, tourism operators, parents and grandparents alike. It's good news for everyone in the province that Dr. Fitzgerald has made this evidence-based decision to change the interval. There's good news on the horizon about more vaccines coming. And vaccines are the ultimate tool that will get us out of here. So just a reminder again that if you are eligible for a vaccine, please make sure you register and please look after yourselves and each other. Thank you, everybody.